Welcome back to Studio 701. If you know someone with bad breath, it might be time for more than just a breath mint.
That's right. We talked with the experts at Prairie Rose Family Dentists about why you should make an appointment. Hello again. I am here at Prairie Rose Dentistry, and I have the exclusive pleasure to sit with Dr. Tom Ehrhardt. So welcome to the show.
Thank you, Michael. A pleasure to be here.
Good. So, of course, we are talking about dental health here today, and we are focusing on some pretty nasty sounding words, gingivitis and periodontitis. So I'm going to let you take the way. What is gingivitis, first of all?
Sure. Gingivitis, yeah, big scary words for some things that describe some conditions of the mouth. Gingivitis is something that affects the gum tissue, the soft tissues around your teeth. Typically people will notice this when they're brushing and they get some blood that they spit out in the sink. Usually that's the first indication to a patient that they might have a problem. So in essence, gingivitis is swollen and inflamed gum tissue that bleeds easily, that can lead to bigger issues like you had mentioned, periodontitis.
Okay, so gingivitis is bad thing number one, and then it sounds like when that gets worse, periodontitis shows up.
Correct. It's kind of a precursor to periodontitis.
Okay.
Yeah, if it progresses and goes unchecked, it can start to damage the supporting structures of the teeth. So going beyond the gum tissue where you've just got bleeding gums, that goes unmanaged, unchecked. You can get bone loss and lose the attachments and the supporting structures around the teeth. So worst case scenario, somebody loses a lot of bone, they end up in a situation where that tooth is at risk to be lost.
I saw a brochure you guys have in here on periodontitis, and it said right on the front, don't wait until it hurts.
And that's with many things in dentistry, is that we don't want to wait for something to hurt, because that typically means we have a bigger problem at hand. A lot of things can be managed and taken care of sooner rather than later. That's why regular dental checkups are so important. If you're seeing your dentist twice a year at least, a lot of these things we can catch before they become big problems. Catch that gingivitis early before it progresses and manifests in any kind of bone loss, entering into that periodontal disease.
Okay. Why did gingivitis show up in the first place?
So the most common reason people end up with gingivitis is because of plaque that sits around the tooth. At the base of the tooth where the gum meets the tooth is where food debris, plaque will sit. If that's not cleaned off very soon, it can irritate the gums and inflame the gums, and that's how they become red, bleed easily. So that's the most common reason. There are other things too. Certain medications can cause inflammation of the gum tissue, and that's something that your dentist can go over with you in your medical history too. And sometimes those medications need to be changed. But usually it's lack of really good oral hygiene and or frequent cleanings with a hygienist.
What else in your field of dentistry possibly are you excited about, new developments, new special things that you're doing here at Prairie Rose?
Well, we have some of the latest and most modern technology that you can use in the dental offices, same-day crowns. That technology is amazing. Any 3D digital work that we can do is really great. New scanning software for all kinds of appliances and prosthesis that we use in the mouth. So those kind of things are exciting.
Well, hey, thank you so much for your time today. I'm sure you're a busy man. I appreciate you so much. Ladies and gentlemen, Dr. Tom Ehrhardt here at Prairie Rose Dentistry.
Thank you, Michael.
And there are 3 Prairie Rose Family Dentist locations in Bismarck and Mandan. Make sure you call to make an appointment. The information is on the screen.